The Health Ministry notes an increase in the vector-borne illness of dengue and leptospirosis cases during the rainy season. The ministry has designated the first week of August as Vector Awareness Week to educate the public on reducing the risk of vector-borne illnesses. Health officials are mindful of the pandemic and, while efforts are geared towards minimizing incidents of dengue, COVID-19 and the mosquito-borne ailment may have a few things in common. However, there are symptoms which differentiate the two.
They both can have infected persons without symptoms, that is, you're asymptomatic, while some presents with a mild form of both diseases. With, for instance, dengue, you may have fever, headache, muscle ache, joint pains, a rash, among others. And it is important to know that in the late stage or stages of dengue, you may very well have a cough. For a more severe form of dengue, as pointed out, persons may very well have abdominal pain, they have persistent vomiting, and some may have bleeding from the gums, among other places, and a change in the level of consciousness.
The dengue virus has 4 strains. The government is concerned that French territories have recorded a spike in outbreaks in types 1, 2, and 3. In St. Lucia, the health authorities have registered 41 cases thus far in 2020, with a prevalence of type 3.
The age group most affected would be the 5 to 9. So our kids are being affected, followed by the age group 10 to 14 years. But there has not been any difference in the sexes. The areas that we have noted with highest prevalence, and that is not just numbers, but based on the population of these areas, we have noted that the areas of Redwee, Mon Road, Castries City in general, Millet, Old Victoria Road, Monier, and Tuapito areas have the highest prevalence of cases of dengue reported to the Ministry of Health.
Persons who have contracted the dengue virus for a second time may be at a greater risk of becoming severely ill. The public is advised to clear their surroundings of containers, drums, and garbage to prevent breeding sites for mosquitoes which carry the virus.
We've been receiving a number of calls from the Department of Environmental Health from members of the public saying, can you come around my community? We have a lot of mosquitoes, we need the spraying done. So the spraying or the fogging, which is normally asked for by the public, it doesn't really tackle the problem at its source. So the things that we try to keep the public abreast on in terms of small things that you can do around your home, check your drums, your containers, are they properly covered? Do they have water in it? Is it properly covered? Do I need that water? Is it necessary that I store and collect that water?
Littering and indiscriminate dumping of garbage can also contribute to vector sites. The Health Ministry is partnering with Solid Waste Management Authority to spread the Vector Awareness Control message. Colby DeVoe, HTS News Force.